Surgeons are specialist doctors whose role involves using scalpels and other tools to physically change the body, which usually means removing diseased tissues or organs such as tumours or an inflamed appendix. This video will focus on general surgery, the most broad-ranging of the surgical specialties, including what the role involves, the different types of general surgeon, and most crucially, how you can become a general surgeon yourself. As the name suggests, general surgeons are responsible for treating a very wide range of conditions but are mostly concerned with the abdomen. Common conditions that might require your attention include appendicitis, hernias, gallstones, and cancers throughout the digestive tract. General surgeons can work across both small and larger hospitals, but in either case your shifts can often be long and unpredictable with plenty of nights. This is because your skills will be in high demand while you're at work, whether that means being called to the emergency department to assess a patient who might need surgery, or rushing to theatre to deal with an urgent trauma case. It will involve explaining the risks and benefits of procedures to patients before their surgery, as well as looking after them on the wards after their operations. You'll be working alongside a team of surgical nurses, operating department practitioners, learning from more senior surgeons and teaching younger doctors and medical students. As with all specialties, you'll first need to complete an undergraduate medical degree, which is usually 5 to 6 years. After this, you must work for 2 years as a foundation doctor to acquire your core medical skills, which will usually involve at least one job working in a surgical unit. After this, most trainees will apply for core surgical training, or CST, which takes 2 years. Alternatively, a 3-year IST program is being piloted in some regions of the UK. Entrance to general surgery training at ST3 level is competitive, with between 4 to 5 applicants per place in most application cycles. Then once you have successfully secured your training post for general surgery, you'll complete 5 more years of dedicated specialty training. As with all surgical specialties, along the way you will need to complete both the membership exam and later the fellowship exam of the Royal College of Surgeons in order to complete training. While most surgeries carried out by general surgeons are routine, nearly all of them have a subspecialty interest. There are many of these to choose from, including breast surgery, upper GI, colorectal surgery dealing with conditions of the lower digestive tract and rectum, endocrine surgery of glands such as the thyroid and adrenals, trauma and emergency surgery, and organ transplant in the most specialised units. It's a rapidly evolving specialty that is especially concerned with minimally invasive or keyhole surgery, allowing operations to be done through tiny incisions which cause less pain for patients and mean they can leave hospital sooner. In order to boost your chances of becoming a general surgeon, here are some great things to do. Get involved with your local surgical society while at medical school, shadow surgeons and see the types of operations they do, and be enthusiastic as you do. Attend surgical conferences to demonstrate your interest and commitment to surgery. Surgical skills courses are a great way to practice those skills you'll need for theatre, and make sure to develop your hand-eye coordination that you'll need for operating. You might try to carry out research, presenting it at conferences and try to publish in medical journals. And lastly, teaching experience will also stand you in good stead, as surgical training is like an apprenticeship and you'll need to teach your juniors and medical students. So lastly, let's just summarise everything we've covered so far. The pros of general surgery are many. It's a dynamic and exciting specialty where few cases are going to be exactly the same. It's hands-on, practical and satisfying for trainees, and there are many opportunities to sub-specialise in an area of your interest. You're encouraged to perform research and develop new techniques, and you are very likely going to be responsible for teaching junior surgeons and medical students. However, a career in general surgery means long and competitive training, with similarly long and unpredictable working hours, including many nights and weekend shifts, which many other specialties don't have to deal with. General surgery is high stress and complicated work, with fatigue being quite common among trainees and consultants. And lastly, as with all surgery, there is the risk of things going wrong and litigation as a result. So what's your favourite thing about general surgery? Let us know down in the comments. If we've not talked about your favourite medical specialty yet, or you have any requests for videos that you'd like to see, write those down too, and we'll have an episode ready for you very soon. Don't forget to hit that like button, subscribe to the channel, and turn on that notification bell to make sure that you don't miss any other medical careers videos. Take care guys, and we'll see you next time.